I'm Tammy Johnson. I'm here to show you Male Peri Care. I did a close-up on Male Peri Care on another video, but you should still be able to see for the most part. Okay, I'm going to do it from the beginning to the end. Knock on the door. Hi, Mr. Jones. I'm Miss Tammy. I'm here to provide Male Peri Care, hand hygiene, and then I also like to pull the curtain and get my water, kind of do that together. Also, I just want to mention on this skill, we will have a bed protector, we have a bath blanket, and gloves. And at this point, I'm going to raise the rail, which is a critical step. If the bed is moving up or if the bed is moving down, the side rails have to be up or you will fail. Then go back around to where your supplies are, raise the bed to a good, comfortable position for you. Shouldn't see you bending over, tippy-toeing, and just get it to where you're comfortable. Lower the side rails because we do not work over the top of the side rails. There is not any skill that I can think of that would be okay to work over the top of the side rails. I am then going to put my bath blanket on. As we have in so many other skills, we cannot shake it because it creates linen, it creates bacteria that the resident can breathe in. Within a couple of days, they could end up having pneumonia from the lint particles. Also, some of the things I see students do with bath blankets is not unfold them all the way. It has to, because when you turn them, the resident and the state instructors there, the whole body needs to be covered. Now, you can pull the sheet down. I like to sometimes kind of hold it in the middle, and if you'll pull it down straight, it'll come up easier. You can also tuck it under the shoulders, and that frees your hands up to a shirt. Now, I'm just going to go down past the peri area. You don't have to go all the way past the feet. I am then going to put my gloves on. I'm not against you putting your gloves on before you put the bath blanket on. The important thing is that you have them on before you do the cleaning. I'm going to pull this up. I am going to remove this a little bit so that you can see what I am doing. I'll take the bed protector and I'm going to get it ready. Kind of turn them just a little bit. Place it under their private area. I'm going to pull. I don't want to see you reaching way over for your basin, so pull this up really close to you and make your mitt. Hold it here. Hold it here. And up. Now, you really don't need a mitt for this. You really just need to use your finger, but you can make the mitt and use the corner. Okay. At this point, I'm going to clean around the tip of the penis, moving my washcloth. If the foreskin is intact, you will need to pull that back and clean with soap and water. And then we will take a washcloth and we will rinse that area and put the foreskin back. And then, because the penis will be in an upright position and your book says to clean downward, it means that we're wiping away from the meatus. The meatus is where the urine comes out. So we're just kind of wiping away. Notice how I'm turning that washcloth. Then I'm going to rinse that same area. And of course, you're going to say you're going to wash and rinse till clean. I'm going to wash the scrotum area. And I'm going to rinse the scrotum area. And I'm going to observe for any redness or irritation. I'm going to pull the gown down. I'm going to replace the bath blanket. I'm going to tuck the bath blanket kind of in between his legs, using the bath blanket and using the shoulder and the hip. I will turn, have the resident lay up there, and then I'll pull this back so you can see. But now this time I can make a mitt. And I have soap, and you're going to wipe from the scrotum to the rectum, and you need to say that. Turn that washcloth over, scrotum to the rectum, and you will wash that till clean with a different part of the washcloth. Very important that you say that. And you will rinse saying that same verbiage. Scrotum to the rectum, turning that washcloth. And at this point, I'm going to remove my bed protector. In any skill that you remove a bed protector or a towel, that is when you remove your gloves. So I'm going to remove those. And then I will lay them down. Be sure that when you're going to lay them down, anytime with a bath blanket, that you don't wrap that bath blanket up around them. I'm going to pull my sheet back up. And you just kind of, if you need to, it's okay to go up under here because sometimes it will catch on some of the mannequins. And then I put that sheet up here. I'm going to roll the bath blanket down. I'm going to roll the bath blanket away, and that will go into the linen. Often she will just take that from you and put it in the linen cart. And when you're straightening the bed like this, focus on this side because you can straighten on that side when you get over there, and you don't have to, you won't be leaning on the resin. Raise your rail up because you're going to lower the bed. So all four of the rails need to be up. It's a critical step. Lower the side rails. Come around here. Now when you come around here to lower the side rails, that would be when you could go ahead and finish straightening on this side. Get it looking, because that's a part of making sure your resident is comfortable, making sure the call light is within reach. You can't just say it. It needs to be on top of the resident. Hand hygiene and report and record.